When we talk about sleep, I mentioned it's kind of an afterthought for some people. What about digestive health and the role that that plays in our overall health? People think I feel fine, so my digestive health must be okay too.
The new epidemic for this century is autoimmune and immune disorders. It used to be, people think, well, most people die from heart attacks and strokes, and it's always been so. Those used to be very rare until 150, 200 years ago when the Western diet started to come in. Then about 30, 40 years ago, the food processors realized if they destroy the enzymes in food that normally ripen the food, they get a long shelf life. The unintended consequences, those enzymes are critical for digesting food. Because of that, we are not completely digesting the food we eat. And when you have incompletely digested food and what's called leaky gut from excess sugar and antibiotics, all of a sudden you're absorbing partially digested proteins into your body, which are called allergens, and it overwhelms the immune system and triggers autoimmune disease. It also causes poor digestion. So here we have poor digestion because of inadequate stomach enzymes. And digestion, there's two things, enzymes and stomach acid. So instead of giving the enzymes so we can digest the food, what does the doctor do? He turns off the stomach acid with these little purple pill acid blockers. Now you have no enzymes, no acid. You don't get the acid reflux, it doesn't burn. You also have no digestion. And you say, but the poop is brown. Yes, because you add bile to it and you chew it. But the food is not properly digesting. Now again, it's not this big macroscopic, you're not going to have your cucumbers coming out in there. But the proteins are incompletely digesting. So you're getting indigestion, you're getting immune problems. The solution. If you just stop the little purple pill, you'll get what's called rebound excess acid hypersecretion. Basically, the Niagara Falls of acid will come pouring in your stomach, and you're going to curse my name for putting it in your mind to come off the things. They're addictive. The studies show if you have no heartburn at all, you take the little purple pill for 6 weeks, it is addictive and will cause, you can't come off it. So what do? Number one, you take plant-based digestive enzymes. Animal enzymes do not work for digestion. Those work for inflammation. Something like Complete Chest is a good one. You add some acid to your meals. A little bit of betaine HCl tablets from your health food store, some diet cola. Cola has the same acidity as stomach acid. That's why it'll digest nails. So 4 ounces of refrigerator cold diet colas. You do those, that'll help that digestion. You take things like DGL licorice, masticum, things that improve stomach defenses. After 4 to 6 weeks of that, you'll find you can switch from the little purple pill to Tagamet, which you can get over the counter, cimetidine. That doesn't turn off stomach acid, just turns it down. And then after 4 to 6 weeks, most people can wean off of the acid blockers, and now they're home free. If you go on I have an app, Cures A to Z, so C-U-R-E-S, capital A, Z. All of these different topics, you can look it up and it'll say, here's what you do, boom, 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 just right there. So I don't expect people to be scribbling frantically with all of this. But it's just a nice, easy way to heal digestion, and all of a sudden you're going to be feeling well, and you're going to be having, your whole body will be getting healthier for it. One other quick thing is if you're chewing on calcium tablets, Tums kind of things, and digestion, that's been associated with increased heart attack risks. I recommend people use something called immediate heartburn relief, which is a calcium, magnesium, vitamin D, vitamin K chew, which is heart healthy and works every bit as well. So simple, healthy ways to improve digestion.